Church, it's been a long time here, and I hope you all have been doing fine and you have been amazing. I want to use this opportunity to thank Daddy and all the pastors for this privilege to be a part of the team that will be giving these health tips. And I'm sure that you have been blessed in one way or the other from these tips, or you have been in a position to be able to educate or empower other persons to live elderly. And so today we are going to be talking about something that is quite common, yet with so much misconceptions around it. And the essence of this discussion today is to actually clarify those misconceptions and for us to be able to have the correct information and the correct idea. And so today I'm going to be talking about teething in children. Now, I'm going to start this discussion by quoting a scripture from Psalm 127 verse 3, which says that children are the heritage of the Lord, and the fruit of the womb is his reward. And it shows that God has given children to parents to be catered for, and one aspect of their life that should not be ignored is their health. And so that is why I think that this discussion is very, very, very important for us to have. And so I'm just going to start this discussion by defining what teething is. Simply put, teething is the process by which children develop teeth, and it's a physiological process. Now, when I say it's a physiological process, I'm trying to say that it is not a disease process. Rather, it is a natural process that the body recognizes and that every growing child should experience. But it's sad to say that in this part of the world, a lot of misconceptions have been tied to it, such that teething has been regarded as a disease process rather than a normal event in a growing child. And so this is why a lot of children are actually being lost to childhood illnesses that are usually described or associated with this event. And one of the reasons why I think this discussion is very important is for this to be cleared out and for us to have a better knowledge and a better understanding of what this event is all about. Now, we all know from our basic biology that there are two types of teeth, and that is the milk teeth and the permanent teeth. And the milk teeth usually starts in infancy, is usually developed in infancy, and then they lose it at some point in their growing up years, and they are replaced by the permanent teeth, which usually remains until adulthood. Now, it's important to say that teething usually begins around the age of 6 months, with the lower incisor being the first to be formed in most children, then the upper incisor, and then the rest of the teeth to form the complete 28 that is expected in that age group. So it's important to emphasize that teething is not a disease. It is a normal growth process or growth event that every young child should experience. Now, in this part of the world, some symptoms are be tied to teething. Parents just have this idea that when a child is teething, it should have fever, it should have diarrhea, purging, and you see a child that is very sick and you ask the mother that what is wrong with your child, and all they can say is the child is teething. That is actually very wrong, because teething is a process that can actually happen without any symptom at all, and the teeth will come out. You just see that the tooth has erupted and there was no symptom at all. And so some of the symptoms that you might even see, if there are going to be symptoms at all, are what I'm going to be listing now. And that is number 1, elevated body temperature. Now, when I talk about elevated body temperature, it just means that the body temperature might be a little bit elevated than the usual normal, but not up to the point where it is regarded as fever, because what we regard as fever is greater than or equal to 37.5 degrees centigrade. That is what we call fever. But in teething, we don't expect that the rise in body temperature will be up to that level. And so when you see a child that is very hot, very hot, and then you are checking the body temperature and it is greater than or equal to 37.5 degrees centigrade, that is no longer teething. That is a disease. That is a sign that a disease process is going on in the body. Now the second thing is drooling of saliva. Now it is possible for children to actually drool a lot of saliva during the period of teething, and that is because of the soreness and the pain in their gum, and so sometimes they find it difficult to swallow the saliva. Then the third thing you might notice is that they will be putting a lot of things into their mouth. Everything they pick, they are putting it into their mouth, and they are using it to rub their gum, and that is just in a bid to apply some pressure on that point, because the pressure actually relieves the pain in a way. So you see them putting a lot of things into their mouth or biting on a lot of things. It's just a way to relieve the pain. And the last thing that you might notice is that they get irritable. They will just be crying excessively, they will just be uncomfortable, they will just be irritable. So those are like the things that you might notice in teething. And sometimes, like I said before, there might not be any symptom at all, and all you will just notice is that, oh, the tooth is out, and that is all there is to it. Now, having said all of this, I think it's just important to mention that as a parent, there are some things you might do or you can do to actually help your child. One of them is you can give them over-the-counter antipyretics. And when I mean antipyretics, I mean drugs that can reduce body temperature. You can give them like syrup paracetamol, syrup ibuprofen, but anything much more than that, please do not give. I know that in this place there are so many syrups or drug mixtures for teething. I don't want to mention names, but I know that there are so many over-the-counter medications for teething. Those medications should not be given. The only thing that you can give a child that is teething is over-the-counter paracetamol or ibuprofen, just to lower the body temperature and nothing more. Now, another thing you can do is you can wash your hand and then use your clean hand to apply some pressure over the gum. That in a way gives some relief. Or you could actually use a clean gauze. After you have washed your hand, you put some water on a clean gauze and then you use it to rub over that gum. In a way, that gives some relief and helps the child. But anything much more than that, you are not supposed to do. And that is why when a child is having elevated body temperature, I mean running a very high temperature, or the child is vomiting, or the child is passing watery stool, please do not associate it to teething. It is wrong. That is a sign that there is an infective process going on in that child's body that needs urgent medical attention. Do not tie it to teething, because teething is not a disease and should not give all of those symptoms. Now, just in a way to make us understand why it is not so, I told you before that teething usually begins around the age of 6 months, and this is also around the age that the child starts crawling, and so they start picking everything around them. As they are crawling around, they see dirty food, they see dirty stuff, everything just goes into their mouth, and so in that process they could be exposed to a lot of germs, which will eventually make them prone to a lot of infection, especially the gastrointestinal infections. And that is why it seems that it is around that age that they start teething, that they become prone to these infections. So that's why you could actually link them. But teething is not the reason why your child is purging, or the reason why your child is vomiting, or the reason why your child is running a high body temperature. It is most likely due to an infective process going on in the body which needs urgent attention. So the essence of this discussion today is for you to know, and also to be able to educate everyone around you, that number one, teething is not a disease. Number two, you know the basic symptoms that you should expect when a child is teething, and you know that fever, diarrhea, vomiting are not symptoms of teething. Rather, they are symptoms of a gastrointestinal infection that needs urgent treatment, because it's been found that diarrhea or gastroenteritis, or diarrhea diseases. Gastroenteritis is one of them. Diarrhea diseases is one of the killer diseases in children, and it is still claiming a lot of lives in this part of the world. So please, when you see your child having such symptoms, please respond quickly. Don't be too quick to tie it to teething. So I'm sure that in one way or the other you have been enlightened, you have a better understanding of what teething should be and what it is not. And so this is where I'm going to be ending this discussion today, and until I see you again, make sure you stay healthy, make sure you stay safe, and make sure you keep having a good time. All right, till I see you again, bye.